Medicare uses AI to review your claims before procedures happen. One vendor running the system says their goal is to approve 90% of requests automatically without any human involvement. Well, here is what changes everything about how you should think about this program. The AI can approve your claim, but only a licensed clinician can deny it. A machine will not decide whether you get care. A person will. That makes this different from Medicare Advantage, different from most AI healthcare systems that you've heard about. Hi, I'm Han Brown. This is where AI, policy, and aging collide and where your family fits into all of it. Well, I'm going to show you exactly how AI and humans work together in the system, who reviews your claim, what role the algorithm plays, and what happens when there is a disagreement. If you are on Original Medicare in one of the 6 states and your doctor recommends one of the 17 specific procedures, your claim goes through this AI-assisted review. The 6 states are Arizona, New Jersey, Ohio, Oklahoma, Texas, and Washington. The program is called WISER, which stands for Wasteful Inappropriate Service Reduction. This is coverage you paid into for decades. The CMS designed this program after years of watching 2 problems grow. Problem 1, billions of dollars spent on services that do not meet Medicare's own medical necessity criteria. Procedures performed, claims paid, and then audited years later. Problem number 2, the Medicare Advantage AI controversy. Lawsuits alleging that algorithms denied care automatically. Families fighting insurance companies while their loved ones waited. You see, WISER is CMS's attempt to solve both problems at once. Catch the claims that should not be paid before they happen, but do it without letting AI deny anyone. Well, here's why the structure matters to you personally. Without WISER, if Medicare has a problem with your claim, you find out after the procedure. You already had the surgery. You already owe the money. Then you fight about it whether it should have been covered. Under WISER, the review happens before. If there is a documentation problem or a coverage question, you know before you are on the operating table. That changes the entire dynamic. The question is whether the system actually works as designed. So let me show you exactly what happens when your claim enters the system. This is not speculation. CMS published a full implementation details in the Federal Register on July 1st, 2025. They released the provider and supplier operational guide in October 2024. So I've taken a look at both documents. The process is documented in detail, including specific review timelines. So on November 6, 2025, CMS announced the 6 technology companies selected to run the AI systems. These are not the same companies that process your current Medicare claims. These are specialized healthcare AI firms: Cohere Health, Genzian Corporation, Humada Health, based in Oklahoma, Innovacker, Vertex Health, and Zeder, based in Arizona. Each company was selected through a very competitive process. Each has existing experience in AI-assisted prior authorization. One of these companies, Humada Health, published their approach publicly. Their founder, Dr. Jeremy Fries, described the system as, quote, build for yes, end quote. That phrase matters. Build for yes means the default is approval, not denial. Well, here is exactly how that works in practice. When your doctor submits a prior authorization request for one of the 17 covered procedures, 3 things can happen. Scenario 1, the AI reviews the clinical documentation against Medicare's coverage criteria. Everything matches. The request is approved automatically. No human touches it, no delay. Your procedure moves forward. According to Humada Health, their system is designed to approve 90% of requests automatically. 9 out of 10 requests approved without any human review at all. Well, that is one vendor's goal, 90%. That is Humana's Health stated target. 9 out of 10 requests approved automatically by the AI with no human involvement. Their system is designed to say yes when the documentation supports the procedure. Now, scenario 2. The AI reviews the documentation and finds something unclear. Maybe a required element is missing. Maybe the clinical notes do not match the diagnosis codes. Well, in this case, the AI does not issue a final denial. It cannot. It flags the case as, quote, not provisionally affirmed, end quote. In plain English, that means not automatically approved. It needs human eyes. So that flag sends a case to a human clinician for review. Scenario 3. The AI identifies a clear mismatch between the request and Medicare's coverage criteria. Again, the AI cannot deny. It flags the case for human review. In both scenario 2 and scenario 3, a licensed clinician makes the final decision. You see, this is structural protection CMS built into the system. You may be thinking about what happened with Medicare Advantage. Well, there's lawsuits, the investigations, AI systems accused of denying claims automatically at rates that seem impossible for humans to be reviewing. Families testify before Congress. Patients describe being cut off from care while still recovering. The phrase death by algorithm appeared in news coverage. Well, why is there a structure to prevent that scenario? This is original Medicare, not Medicare Advantage. Different rules, different oversight, different accountability. The most important structural difference is what the AI is actually allowed to do. In the Medicare Advantage cases, AI systems could and did issue denials. The question was whether humans review them adequately. But in Wiser, the AI cannot issue a denial at all. You see, this is directly from CMS. All recommendations from non-payment will be determined by appropriately licensed clinicians who will apply standardized, transparent, and evidence-based procedures to the review, not an algorithm, a licensed clinician every single time. So let me break that down, what the AI does versus what humans do. The AI matches your clinical documentation against Medicare's published coverage criteria. It checks whether the submitted information meets the requirements. It routes and triage requests. It issues automatic approvals for qualifying cases. The AI cannot issue a denial on any request. It cannot override a physician's clinical judgment. It cannot make coverage determinations on complex cases. The human clinicians review all potential denials. They conduct a peer-to-peer reviews when requested. They apply clinical expertise to ambiguous situations. They make final coverage determinations. You see, CMS requires that these clinicians have, quote, the expertise to conduct medical reviews, end quote. They must apply, quote, standardized, transparent, and evidence-based procedures. When the AI flags a case, the clinician reviews your full medical record, not a summary, not an algorithm's interpretation, your actual clinical documentation. If they determine a procedure does not meet medical necessity criteria, you receive a written explanation. You receive your appeal rights, and this is important. You can resubmit with additional documentation. So there is no limit on resubmissions before the claim is filed. Your doctor can also request a peer-to-peer review. Well, that means a direct conversation between your physician and the reviewing clinician to discuss specific case. Here are the specific timelines you need to know. Standard prior authorizations review, 72 hours, 3 calendar days from submission to decision. Expedited review for urgent cases where your health is at risk, 48 hours, 2 calendar days. Well, compare that to current Medicare Advantage prior authorization, where reviews can take weeks Once approved, your prior authorization is valid for 120 days, 4 months. That gives you time to schedule the procedure without rushing. So 72 hours for standard review, 48 hours if your health is at risk. Once approved, you have 120 days to schedule your procedure. And if you need to resubmit with additional documentation, there's no limit on how many times you can do that. So here's what you should do if you are on the wiser state. First, confirm whether you are in one of the 6 states: Arizona, New Jersey, Ohio, Oklahoma, Texas, or Washington. Second, if you have a procedure coming up, ask your doctor whether it is on the wiser list. The next video in this series covers all 17 procedures. Third, understand your appeal rights. If you receive a non-affirmation, that means the request was not approved. You can resubmit with additional documentation. Your doctor can request peer-to-peer review. You can file a standard Medicare appeal. And fourth, keep your medical records organized. The AI is matching documentation to criteria. Complete documentation means faster approvals. So do you support Medicare using AI this way? Put yes or no in the comments. So here's what this comes down to. Medicare added AI to claims review. That's real. That is happening right now. But the structure matters more than the headline. The AI is designed to say yes. One vendor targets 90% automatic approvals. The AI cannot deny you. Every denial requires a licensed clinician. Your appeal rights remain exactly as they have always been. Your doctor can still advocate for you. Peer-to-peer review is available. The timelines are faster than current Medicare Advantage. 72 hours standard, 48 hours expedited. So this is not a system designed to reject you. CMS built it to catch documentation problems before they become your problem, while keeping human clinicians in control of every denial decision. So if you need to explain this to your family, here's a simple version. Medicare is using AI to review some procedures before they happen. The AI can say yes automatically, but if there's any question, a real doctor has to review it. The AI cannot deny your care. Only a person can. That's it. That is what matters. So whether it works that way in practice is something I'm following. I'll report what actually happens when the real claims enter the system. In the next video, I'll cover the 17 procedures included in Wiser. I will show you the complete list, which medical categories they fall into, and how to know if your planned procedure is covered. And if you are helping a parent, a spouse, understand what this program means for their care, send them this video. The key point is simple. AI approves. Only a person can deny. So are you in one of the 6 states? Well, drop which one in the comments. And if you have questions about specific situation or want to verify any of this in an actual CMS document, well, I'm building Medicare Brain. It's a tool that answers Medicare questions instantly, plain English, with the exact source page so you can check it yourself. Drop Medicare Brain in the comments for early access. Remember, AI approves. Humans decide denials. Your rights intact. That is the structure that protects you. So you've navigated harder systems than this, and you'll navigate this one too. Take care.